Congratulations to the Fat Disorders Research Society for putting on such a terrific conference where people can come, meet each other, learn science, learn new techniques, and network. It's really, really powerful. I want to thank Yvonne Russell and Cheyenne Brinson for the invitation to come and speak here today, and it really is my pleasure to be here. My name is Jan Chambers, and I'm the president and founder of the National Fibromyalgia and Chronic Pain Association. Our attention is on chronic pain generally and fibromyalgia as a chronic pain disease. The collaborative work and research focus that's here at this conference is really heartening. The material that was presented by Dr. Dudak, I think you say it, was really helpful, and it laid a good groundwork for what I'm going to share with you today. So I am a chronic pain patient, and complications from a hysterectomy about 11 years ago pretty much left me bedridden for 2 years. And as I tried to go forward, I needed help, and I decided that I wanted to reach out and develop a support group locally, and I needed mentors. I needed to find out how to get my life back and get a reason to live. And so everybody has a journey. Every person in this room can talk about the times or the dates that there were changes in your life. And so as we each have that chronic pain journey, or that journey with our DIRCMs or with the lipedema, it's important for us to know how to be able to share that with others. And there's an emotional part of sharing your story where it becomes a purpose and a meaning. And so I'm really appreciative to be able to be here today and to think about how we can, what do we do to change that chronic pain journey, and what will it look like in 1 year? Because time's going to pass anyway, and so we really should be using the time well. Your story's not over yet. You be the author. So our paths have probably not crossed before, so I'd like to tell you a little bit about the National Fibromyalgia and Chronic Pain Association. We serve a very large patient community. There are approximately 10 million people with fibromyalgia, and I understand from the studies that I've done this week, or the reading that I've done, that many people with Derkham's disease have similar symptoms, not all of the symptoms of fibromyalgia, but many of the same symptoms. And so when you think about the modalities and the treatments, they often cross over, and they work for both diseases. We reach out. We have a large touch point. We have a website that we actually are just creating a second one because the first one became it wouldn't work on phones as well as we wanted it to. But we reach out to about 300,000 constituents through our newsletters and websites. On Facebook, we have 165,000 fans, and on Twitter, it's around 6,000 followers. So essentially, we touch about 500,000 lives weekly, and we take that responsibility very, very seriously. So we are a patient organization. All of the people who participate are either volunteers or they have a chronic pain condition, and so we are really steeped in it, and we really understand it. So what do we do? Well, the National Fibromyalgia and Chronic Pain Association unites patients, policymakers, and healthcare, medical, and scientific communities to transform lives through visionary support, advocacy, research, and education of fibromyalgia and chronic pain illnesses. That's a lot of words, but we utilize every one of those. Personally, I've served on FDA panels, Health and Human Services work task forces to develop the National Pain Strategy, as well as the Federal Pain Research Strategy, the Interagency Pain Research Coordinating Committee for NIH and HHS, and then I helped to develop the Consumer Pain Advocacy Task Force, which is an organization that has 16 member organizations of chronic pain conditions and advocacy. I also have testified to the Senate on several occasions about the impact of chronic pain on America's health system, families, and employment productivity. So how do we gain this information? We do large outreach with national surveys. We also have our Leaders Against Pain who are in the communities, and they give us feedback and information about what's happening in their states and how federal legislation is impacting them. So today we're talking about the impact of chronic pain and the basic foundation of self-management. It's so important to always remember that you are not alone. You need to invest in yourself and your future and get grounded by developing self-trust. You're powerful and strong. Be the captain of your ship. So what is pain management, self-pain management? It's that time between clinical visits when we're responsible, when we are the captain of our own ship, and when we need to take the activities that we learn here today and the information and apply them in our lives. There are 4 spheres of pain self-management that need to be strengthened: physical, emotional, spiritual, and mental. So what we've found is that if we can learn to manage chronic pain with ease, being empowered by awareness, science, and educated engagement. So educated engagement is a kind of a different term for being involved in advocacy issues, but it's more important to understand that it's an educated advocacy and engagement with your healthcare provider. You are a partner in that relationship. So when we talk about acute and chronic pain, the definition is that acute pain is a normal sensation that alerts us to possible injury, but chronic pain is different. It persists and can last for weeks, months, or years. And chronic pain is often accompanied by other health problems, including fatigue, sleep disturbance, lack of appetite, and mood changes. So how many people in America have chronic pain? According to the Institute of Medicine report, Relieving Pain in America, that was published in 2011 and that has been the basis for everything that we've been doing for the past 5 years, 100 million Americans have common chronic pain conditions. That's more people than are affected by heart disease, diabetes, and cancer combined. It's a lot of people. It's 1 in 3. And that does not include people in the military, children, people in prison, or people who are in long-term nursing care facilities. When you think of 1 in 3 people, how many of them have severe disabling chronic pain? Something that stops them from being able to live their lives, to be productive, to engage in their families, to hold a position outside of their home. 30 million Americans have severe disabling chronic pain. And I mentioned a few minutes ago that Derkham's disease and fibromyalgia have common symptoms and may overlap in the same person. So we need to connect with others who share our life experiences and can improve your life. I'm going to pause right there, and can improve your life, because we have to protect ourselves sometimes from negative, toxic relationships. It's really important to be self-empowered and understand that you can do that and you should do that for yourself. We're here to learn new ideas, and as you connect with others, then you are able to implement those ideas and have a better quality of life. The NFCPA works with Share Care, which is Dr. Oz and Oprah Winfrey's patient engagement community, and we also are the experts for Inspire, which has over 1 million members, and we are their experts for chronic pain and for fibromyalgia. These are amazing social places to go connect and ask other people questions that you may not find easily on the internet, and often the patient experience is just what we need. We should never, ever give up hope. There will always be a way that we can figure out a different tool in our tool bags. And we need to rely on each other. As we've built our organization, it has really turned into be a safe place where we can come. And if somebody is late to a meeting, we understand when they say, I've been asleep in the middle of the day. You need that sleep. That's good. We're glad you got it. We'll catch you up in the meeting. And so developing those safe places where you can develop your treatments is your responsibility. Invest in yourself and your future. Great things are done by a series of small things brought together. So creating a tool bag. We're going to talk about the statistics and some of the things that other people are using in just a minute. So I took a snapshot of a current national survey we have on right now about what people are using for treatments that are effective. Pain relief wasn't permanent, and I was not surprised to see how many self-management tools were at the top of the 75 treatments that we asked about. When I am in, and I'll be in DC next week for the FDA panel meeting to discuss the prescribing requirements of education for the doctors. And then after that, there's going to be a meeting with the National Pain Strategy Working Group with HHS and the different appointees from the federal agencies. When I'm there, I'm always advocating for our position. We need help. We need research. And we ask all the time for input. We want to know what's going on in your life. We want to know how the policies are impacting you. We want to know if you're able to go to your doctor or your healthcare provider and get the services that you need. We're just coming through some legislative sessions, and I was very pleased to see that Utah adopted a reasonable opioid prescribing policy. We're very concerned about people who have substance use disorder and chronic pain, and we want to have safe treatments, but we also recognize that's an important treatment that needs to be available for people who rely on it. So, on to the treatments. That maybe isn't showing up very well. So, the current survey that's out right now, 68% of the people are using over-the-counter medications, 62% supplements and vitamins, 54% heating pads. I have 5 myself. And 42% are using cognitive behavior therapy or similar. 38% are using prescription pain medications. 35% yoga and stretching. 32% walking. 30% a change in diet. 30% are using trigger point therapy. 28% meditation. 30% myofascial release. 22% are using distraction. That should have been actually water exercise, I apologize. And 18% are using distraction. This is a little different picture than what we saw 3 years ago. And one of the pieces of this survey asks people if they are able to get their insurance to cover the treatments that they need, and where we need to advocate for more access to the treatments that people are paying for out of pocket. Because we know that if people are doing that step, then that's what the insurance companies should be covering. So 3 years ago, we had a similar survey, and we found a little similarity to what we're seeing now. But 80% of the people found that using a hot tub or a hot bath relieved their pain best. Walking keeps coming in at a high level. Physical therapy, and you can see the percentages as I go down. Meditation, cyclobenzaprine, yoga, acetaminophen, Ultram, Ambien, and Lyrica. The second part of this graph is the people are using trazodone, marijuana, tricyclics, guaifenesin, fentanyl, Provigil, Sonata, Rosarum, and ketamine infusions. So the access to these treatments has changed a bit, and that may be a reflection of what we're seeing in this new survey. So we asked people, what drugs are you currently using to manage your pain? This was 3 years ago. So NSAIDs were the top, so SNRIs, the antidepressants, acetaminophen, hydrocodone compounds, cyclobenzaprine, SSRIs, Neurontin, Ultram, Ambien, Lyrica, trazodone, oxycodone compounds, tricyclics, marijuana, extended release oxycodone, Lunesta, morphine compounds, Rosarum, Xyrem, ketamine infusions, and Sonata. And I'll pause right here and just comment on the Xyrem. That was a drug that we really hoped would get approval from the FDA several years ago because it helps people to get a very deep sleep. And across every pain condition, the lack of deep sleep is perpetuating much of the problem that we have. Many of the symptoms are related to that. So we talked about, and this does show up better there than here, so the comparison of ever and current drugs. So people, you can see what they tried and then whether or not they are staying on it. So hydrocodone compounds, about half of the people who tried it. NSAIDs, can you read those words? Yeah, you can read those words. I don't need to read them all. And so I'll just pause for a minute so you can see that people have tried a lot of different medications and a lot of different treatments. So we asked this group, again, what is the most efficacious treatment modality? Not just what are you using or what you've used in the past, but what is the most efficacious? And the hot bath comes in first again, and pacing myself. And so we haven't talked about that very much, but pacing yourself it takes time to hone that skill. Be able to say, to compartmentalize your time and compartmentalize your desires and what you want to do on a day when you're feeling really well. Massage, stretching exercise is huge for all of us. Walking, and you'll see consistency in these lists. Hydrocodone, physical therapy, meditation, NSAIDs, SNRIs, cyclobenzaprine, and yoga. And I want to pause on yoga for just a minute. There's some very important studies out of Stanford University that show that chronic pain is a disease that advances in the brain. And yoga was one of the few activities that people could do on their own that actually thickened that prefrontal cortex from the thinning that occurs in chronic pain. And so low-impact yoga will actually help your cognitive functions better. You may have already discovered that on your own. Most exercise helps us to feel better, but yoga in specific. So we asked people, why are you no longer using medications that you previously reported as being effective? I stopped taking it on account of side effects was the largest reason. It ceased to be effective. It helped pain, but caused some other problems. Not applicable. I can no longer afford that medication. My doctor would no longer prescribe it. I found that non-drug strategies worked better. I heard bad things about it. I decided to stop all medications. My pain improved sufficiently for me, and I became addicted. So having those, Cheyenne has the slides, so if you're interested in looking at them later, I think that they'll probably be published. But we'll share with you in about a year when we have the results of the current survey. We work with some very good researchers who prepare the material to be published in the journals that are peer-reviewed for the researchers and the clinicians. And we've had some very wonderful success. I'd like to tell you that as a patient, these are major milestones. As a patient going forward and working in this area and having the researchers and the clinicians willing to come together and work with us, it's huge. It's a big step and it's a big change. So right now, our organization has what's called a PCORI grant, Patient-Centered Outcome Research Institute grant. And it's a minimal budget. It's learning how to manage $15,000 this year so that we can go on and build a patient-centered research center about the questions that we care about. What makes our life meaningful? When we see those list of treatments, which ones are more effective? These are surveys, but if we were able to put those into clinical trials, that would be the step we need. And we would be able to take that to the insurance companies. When I've gone to the large insurance companies like AHIP, the America's Health Insurance Partners, they were very clear. You need to bring us research. You need to bring us the results so that we know that we are paying for things that people are going to get benefit by. And I won't even talk about the Affordable Care Act. We're very, very alarmed and concerned for people with the pre-existing conditions. And I'll just leave it at that. But your voice really does matter. And I didn't put it on this slide, but we have a website called yourvoicematters.info. And we ask you to reach out and connect with your legislators to let them know how you feel about the policies that they're creating and the changes in insurance, and that includes Medicare and Medicaid. So in conclusion, please know that chronic pain is a serious and a growing problem. Chronic pain is a disease, and it's going to continue to worsen over time unless the pain generator is stopped. And I'll say that again. Unless a pain generator is stopped, whatever's causing your neck pain, your leg pain, that needs to be addressed, whether it's through one of the treatments that were on this list or treatments that you've found that work for you, or with medications. But it's really important to get that pain generator stopped so that the chronic pain disease does not continue to co-opt the areas of the brain. And I like to just add this quickly. We often have heard it's in your head. And we have railed against the psychological aspect of it. But the truth is, it is in our head. The central nervous system is not functioning properly, especially in fibromyalgia. Fibromyalgia is at the end of that continuum of pain when the central nervous system can no longer properly support the functions of the body. And so you have the disruption in sleep, the irritable bowel syndrome, vulvodynia, TMJ, all of the problems that coalesce. There are about 14 different coexisting conditions with fibromyalgia, and I expect that there are with Derkham's disease also. So be an active self-manager and partner with your healthcare provider. It's the best option we've got until we can get the research on the way. And that's what you're here to do, to support the Fat Disorders Research Society. They need you. They need to hear from you. They need to know what you want to have researched. There are so many areas that they could focus their attention. So power words matter. Surround yourself with good people, not toxic people. Surround yourself with good words. It really does matter because you're in a stew yourself. And I apologize, I couldn't see what's on the back of your card when you lifted it up. Oh, 10 minutes? Okay. Oh, wow, I've never done this. We have a meeting every month with the volunteers and leaders across the nation, and when we were preparing the agenda Friday, we count up the minutes, and it came in at 45, and they didn't say it right out, but they said, when you get onto the internet and you show us things, show us where to go and find more information. We build in an extra 15 minutes to the meeting. So I appreciated learning that. Now I know their secret. But there are places to go and get really good information. And I encourage you to look at the Interagency Pain Research Coordinating Committee. That's basically the top level of pain research coordination in our nation. And on their website, they have links to find out what the research is going to be. When I go to that meeting in 2 weeks, I will be able to hear the newest research that's going to be published and the new advances in science. And we'll share those back out through our magazine and through our newsletters. So there are things that are happening.